The next group is going to present on occupational therapist competency in early literacy development.
Hi, everyone. I'm Bethany.
I'm Alina.
I'm Nava.
I'm Michaela. We wanted to give a special thank you to Dr. Brewington and Dr. Brown for their assistance and guidance throughout this project. And we're going to be presenting on occupational therapist competency and early literacy development. So for a little background, occupational therapists play a crucial role in early literacy development through various methods. Occupational therapists help to develop preliminary literacy skills, including fine motor skills, sensory processing, visual perception, and overall functional abilities. These skills can significantly impact a child's readiness for and engagement in literacy activities. Existing body of literature reveals that OTs primarily address these skills when treating various other disabilities and deficits not concerning or developing early literacy. Instead, OT's contribution to early literacy development is typically limited to pre-writing and writing skills. In this research, we aim to explore OT's perception of their role and their confidence in addressing EL development in children aged birth to 5 years old. Many of the preliminary factors and elements of early literacy development are areas that occupational therapists already address, such as executive function, fine and visual motor skills, caregiver education, and environmental adaptations. For example, research shows that promoting executive function skills can in turn promote early literacy skills, that visual motor integration skills contribute to both phonological awareness and writing skills, that motor skills involved in object interaction are associated with emergent word and vocabulary skills, and that caregiver involvement is significant in predicting EL skills. However, the existing body of literature reveals that OTs primarily address these skills when treating various other disabilities and deficits, like when providing services for fine motor skills and handwriting, not promoting EL development directly in their practice. Instead, OT's contribution to EL development is typically limited to pre-writing and writing skills. There's limited research to support the full range of interventions and services that fall within the scope of practice to promote EL development. Generally, research has focused solely on OT's role in promoting writing development, including understanding the developmental stages of writing, addressing the underlying sensory and motor skills needed for writing, promoting engagement in writing activities, and involving families and caregivers in writing development. Findings in this area show that play-based occupational therapy interventions can have a favorable effect on the cognitive capacities needed for the development of children's writing skills. The limited understanding among OTs regarding their role in EL development and its essential preliminary skills, as demonstrated in OTs' dissatisfaction in their education on literacy development, lack of confidence in their knowledge of EL, and reliance on experience in the field to develop confidence regarding promoting literacy development may have significant, long-lasting consequences on children's academic success and overall functioning. By not addressing the range of pertinent factors that affect EL development, OTs fall short in providing comprehensive expertise and services.
So our research question was to determine, 1, level of knowledge regarding the various components that together form EL, and 2, their understanding of the role OTs can play in developing EL in children. This research will add to literature raising awareness of OT's role in EL development and providing information enabling OTs to offer the most impactful care possible. Materials and methods. So we used Qualtrics, which is an online survey software, email software called MailChimp, Canva, Microsoft, the Internet, New York State of Health Central Directory of EI providers, email, Facebook groups called the Occupational Therapy New Grads and Students, and AOTA's Commune OT online forum. So this consisted of 81 participants. This was a mixed method study design. Survey questions were developed from comprehensive literature review of early literacy in children birth through 5. Survey accessed and administered through Qualtrics. Survey included questions on demographics, Likert scale questions, and open-ended questions. Participant recruitment was done by email and social media, divided up by research participants. Data collection period was 3 weeks long.
So, as Bethany said, our survey consisted of 36 questions examining the knowledge, confidence, and perspective of OTs regarding their role in developing early literacy skills in children birth to 5 years of age. So here are some examples of the multiple choice questions included in our survey, which looked at OT's knowledge of early literacy skills. So some examples are which of these components are considered components of early literacy, areas of occupational therapy practice associated with early literacy development, which you address in your standard practice include, and what strategies do you incorporate in therapy to facilitate the development of early literacy skills in children with varying diagnoses. For survey questions, which examined therapists' level of confidence regarding early literacy development in this population, we utilized the 5-point Likert scale, ranging from not at all confident to extremely confident. Examples of these questions included regarding early literacy development with children birth to 5 years of age, how confident are you in your preparedness based on your academic education to address early literacy skills in your practice, your ability to collaborate with other professionals such as speech, language pathologists, and educators to promote early literacy skills, your ability to advocate for the importance of early literacy development within the broader community. Regarding early literacy, lastly, we asked participants to respond to open-ended questions, such as, in your opinion, what is an occupational therapist's role in developing early literacy? And do you feel that your skills regarding the promotion of early literacy development could be improved? If so, how? Results of our survey found over 60% of participants correctly identified 4 out of 6 of the components of early literacy. Findings also showed that there's a spectrum of OT's awareness of their role in early literacy development, as well as a wide variety of how they engage in early literacy development within their clinical practice. Knowledge of their role in early literacy development was shown to be varied and inconsistent. Participants also felt that additional trainings or specializations better prepared them to address early literacy skill development in clinical practice than their academic education did. Majority of participants expressed that they believed their skills regarding the promotion of early literacy development could use improvement. They also recognized the importance of acquiring evidence-based knowledge on the components of early literacy. Participants felt overall confidence in their ability to collaborate with other professionals in the promotion of early literacy development, and demonstrated overall that they recognize that they are in an important position to promote early literacy skills.
For our discussion, our findings demonstrate gaps in OT's knowledge of various components of early literacy, as well as their role in developing early literacy. These findings indicate a need for improved education and training on the components of EL, evidence-based practices, and the scope of OT practice in promoting EL development. Addressing these gaps in knowledge and confidence of OTs in developing EL would ultimately lead to an enhancement in the quality of services delivered to children in the early stages of life. Our limitations was that voluntary participation may have skewed biased results towards more knowledgeable individuals in EL, so those choosing to participate in our survey. Also, several questions were unanswered, which may have impacted analysis and results. Also, participants may not have responded honestly or accurately regarding their history, experience, and knowledge in the field, which may lead to the study being compromised. Our data collection period was relatively short, which led to a limited amount of responses. So as mentioned earlier, it was 3 weeks long. We collected 81 responses. A longer data collection period would have broadened our sample size. And a relatively low click rate in our survey also limited the sample size of our data. So our study aimed at exploring OT's role and confidence in their ability to promote EL development. The results of the study provided an insight into the current ways that practicing OTs engage in the promotion of EL development, providing us with information on the strengths and weaknesses within this area of practice. Our recommendations for future research is for further studies to be conducted with survey questions that are that eliminate any redundancy, and this would create better focus within the survey and motivate participants to answer more of the questions. We could also expand efforts to reach a broader OT community, which would add to the data collected on the subject and enhance the accuracy of research. And the data collected in this study could be used to explore further connections and correlations between different elements of our study. So for example, correlations could be found between OT's years of experience and their confidence pertaining to the various questions posed in our survey. Here are references, and that's all. Thank you so much.
Any questions? No. Thank you.